Right. Like your horses that are extremely wide will tend to paddle, kind of like you. Great big, carry a lot of muscle.
I dog paddle.
You dog paddle. But, depending on the job and agility on a really broad-chested horse, sometimes you lose some agility. But if you got a horse that's going to pull, fine. If you got a horse that's got to make fast maneuvers, that type chest isn't going to work. Where one that's more oblong, and then also with the way the rib cage forms back, it needs to be wider behind the rider's legs for the rider. And if you got one that's very broad across there, it's not going to fit riders as well. But if you've got a pulling horse, that may be more of an advantage to them.
When you were talking about maneuvering of a horse, the first thing that popped in my mind is the young lady that we had here in the studio, and she shot balloons.
Yeah, Christy.
Yeah, Christy, what, Shoop?
Dr. Christy Shoop.
Yep, so there you go.
And she's a balloon killer.
Yeah, she rides those almost like barrel racing horses, but shooting balloons at the same time. So you need a close barrel to get around the barrels type deal.
Right. Also,
a case study of a horse named Billy, and the reason why we're looking at this is not necessarily the case study itself, it's the lack of detail in the x-rays that were taken. And you can see, here's the bones, there's the coffin bone, here's the outside of the horse's hoof, but like Mike says, where's I almost said contraband.
Where's the contraband?
Yeah, where's the contraband?
The horn lamina zone's not clear. The coronary bands, you can't exactly, we can guess pretty close, but not exactly there. And, if you're looking, like the navicular bone in that shot, I couldn't tell you the first thing about that.